Welcome to this presentation of what you need to know about leg veins and their treatment. Brought to you by Dr. Jeffrey Riopel of the Laser Advantage Metaspa of San Ramon in San Ramon, California.
We are going to talk to you today about your varicose veins and spider veins. We know that these can be both embarrassing and painful. We'd like to share with you some information about varicose veins and explain the best ways to treat them. Spider veins and varicose veins are not really caused by anything you've done. They are simply a product of the Earth's gravity. The veins in your body and arms usually just work away without you noticing them. However, the veins in your legs can age rapidly and prematurely. Gravity is the body's enemy in so many ways. You can see its effects in your face when your eyelids and cheeks start to droop and the corners of your mouth drop. In your legs, you see the effects of gravity in the form of spider veins and varicose veins. The vein system is different from the arterial system in that veins have thin, flimsy walls. In addition, the veins have a series of one-way valves which keep the blood flowing towards your heart when you are standing up. Unfortunately, gravity works against this system, so that if you often stand for long periods of time, gravity puts pressure on these one-way valves, and they can sometimes fail, resulting in stretching and ballooning of the thin vein walls. This is what causes those ugly and sometimes painful veins to form. It's an unfortunate side effect of doing real work for a living, and one of the worst things about them is that they tend to become more prominent as time goes on. Then they multiply. Gravity is simply a fact of life for us. It affects us 24/7. So unless you've become an astronaut to avoid gravity or you spend all of your time floating in a swimming pool, there's a good chance that varicose veins will be a part of your future. But we'd like to tell you about what we can do now to treat them and make you more comfortable. Leg veins come in all different sizes. The small spider veins are usually just that, small and spidery. They are primarily a cosmetic concern, and we can treat them for you quite easily. The larger and uglier veins can be quite painful, we know. They can lead to burning or aching sensations in your legs. And in severe cases, if it is a larger vein inside the leg which has become varicose, swelling or skin ulcers can develop. This is why it is best to have us check out your veins when they first start to become a problem, rather than wait until you are in severe pain. It can be difficult and costly to treat bigger veins, so it's better to catch them early. We all know that varicose veins cause a fair bit of both physical and mental pain. What does this mean for you? It means you need to do a bit of homework. Consider this CD your textbook. Although most spider veins and varicose veins occur in similar positions on the legs, we still try to be as accurate as we can in diagnosing them. Using ultrasound technology, we can find the specific valve or series of valves which has failed and created your varicose veins. There are two main junction points in your legs which are vulnerable. That is where your surface veins travel deeper inside your leg to join larger veins carrying blood to your heart. One is in the groin, where the long saphenous vein joins the common femoral vein, and the other is behind your knee, where the short saphenous vein joins the popliteal vein. If we do these ultrasound tests, you can have thrombosis or clots in your deep veins ruled out too, which can be more problematic than varicose veins. It is a quick and painless procedure, and very informative for your doctor. It is an individual decision whether to watch and wait or have something done. If you don't have a lot of pain from your veins and you only have a few, you could watch and wait. But keep in mind that it is always easier to treat things in their early stages. The treatment option, which is preferred by both doctors and patients alike, is always the less invasive one. You don't really want to be cut open unless it's absolutely necessary. We want to apply the treatment which will effectively and reliably treat your problem veins. We would look for at least an 80% improvement in the problem, depending on its specific circumstances. When your ultrasound assessment has been done, your clinician will have an idea of whether your treatment is going to be easy or difficult. If the valves at your main junction points are intact and functioning, it is generally easier and more straightforward to treat you, as the problem is mainly on the surface and the veins aren't under high pressure. If the valves at the junction points are not working or there is potential failure at these areas, then treatment becomes a little more involved. But don't worry, we always have a solution. There is an exciting new option for the laser treatment of varicose veins. It's called EVLT, which stands for Endovenous Laser Therapy. You would only have a local anesthetic, so you don't need to be put under a general anesthetic. A laser fiber is introduced into the vein via a very small needle. It is placed in the area of the abnormal valve, which was determined by ultrasound, turned on, and then gradually taken out of your vein. This seals off your abnormal vein below the level of the valve which had collapsed. There are no cuts or incisions to be made, and this technique works extremely well for both the long and short veins and branches, which can sometimes cause you trouble. This option has replaced the old treatment known as vein stripping. Some say this started in the Middle Ages. Thankfully, we've advanced since then. In some cases, vein surgery is an option. There are two types which are still performed. The traditional stripping and ligation technique involves making an incision in the groin or behind the knee, then cutting and tying off the vein just above where the faulty valve was found. After this, a small incision is made in the lower leg, and a probe is inserted, which pulls the vein out with it. This procedure is more traumatic, more painful, and more dangerous than EVLT. There is another surgical option for more permanent treatment of the veins called ambulatory phlebectomy, where you would be put under local anesthetic and have tiny incisions made in your veins to have them removed with a small hook. You should have a fairly quick recovery from this procedure, with few complications occurring. Another option involving injections is called sclerotherapy. In this procedure, a medication which seals off your veins is injected into them. This technique is best for spider veins or small varicose veins, where your main valves are still working. We might also use it to clean up small veins left over after you've had EVLT. Using a new version of this technique, called foam sclerotherapy, we can also treat veins a little deeper in the leg, or those which are bent or too small. In this version, an ultrasound machine is used by the doctor to see the solution entering the vein. A final option for treating the smallest of veins involves the use of a laser or intense pulse light machine. Using this type of treatment, the smaller veins are vaporized by laser light going through the skin. This technology continues to improve and just adds another option in our quest to find less invasive ways to treat leg veins. So you can see why the role of surgery has shrunk in the treatment of varicose veins. In comparison to some of the other new treatments available, surgery can be harsh on your body. In recent years, we physicians have been constantly searching for less invasive forms of treatment to minimize the risk and downtime for you. And we'll continue to do this for you. So don't listen to your grandmother's advice that varicose veins are just something you have to live with. We have many easy, quick, and relatively painless options for treating all types of leg veins, from the tiniest spider veins right up to the large and sometimes uncomfortable varicose veins. We are here to help and don't want you to suffer unnecessarily. So we'd recommend you talk to us to determine which of these treatments would be best for you.
Thank you for listening to this brief presentation. To get further information about leg vein treatment, contact the Laser Advantage Metaspa of San Ramon at 925-275-9333.